Hello guys, welcome back to another video. And in today's video, what we're doing is an interview scenario. And in this scenario, what we have is a patient that's frustrated that the dentist is overrunning. So the dentist has overrun by 20 minutes and the patient has already told them beforehand that they need this appointment to go on time and that they want the full 30 minutes for the appointment. So now it's the dentist's job to manage the scenario and manage how the patient is feeling. And that's what's done in this scenario. Let's get into it. Hi Mr. Shiraz, I'm really sorry for your wait today.
I don't understand why this appointment has taken so long.
We're running behind 20 minutes, unfortunately.
Well, I told you, I called the receptionist earlier and I told you that I need to be seen at 2:30 on the dot because I need to leave by 3. It's 2:45 already and I need to leave soon. No, You're not going to be able to do my checkup properly.
I completely understand what you're saying and I understand that we're running very, very behind. And I'm sorry about that. And I know you informed us earlier as well.
Well, you can be sorry, but you've wasted my time. So what do you expect me to do?
What do I expect you to do for the time that's wasted? There's not much that we can do, but what we can do at the moment...
So am I getting charged for this?
I will try my best to see what we can do and see if that there is a charge. And what I'd like to do is hopefully I'd like to remove the charge so that you don't have to pay anything for this appointment.
Right, that's fine. Okay, but you've still called me into this clinic.
Yeah.
I've spent money on petrol. I've taken time off work, and you've not given me what is expected, what I was supposed to have done.
Absolutely, and I completely understand your frustration. And if I was in the position that you're in as well, I'd be just as frustrated at me as you are now. So I'm very, very sorry about that. And for the time that you've lost and for the petrol that you've lost as well, I'm really sorry about that. What I'd like to do for you today is to try get as much done as we can, or see what we can get done, or if you'd like to discuss further treatment, that's what I'd like to do in the next 10 minutes. Or we could look at another time.
Can you tell me what it was you were doing with the last patient? Tell me what you were doing so I can understand why I was late.
Unfortunately, one of the natures of working as a dentist and at a dental practice is that time, it just builds up on us.
So how do I know that you weren't just chatting away with that patient and keeping me in the waiting room? Because I saw them walk out of the clinic. They came out of your room, they were smiling, they were happy. It's like you were just having a chat.
No,
Whilst I was here getting frustrated, no one told me that why you're overrunning or what was happening.
That is our fault as well. We should have informed you, and I wish that either I had known myself or if my nurse had known, and that we'd come out in between the appointment just to let you know that we are overrunning.
So then tell me, why didn't you?
Why
did no one tell me what was going on?
That was negligent on our behalf. And this is a mistake that we'll learn from, and we'd hope to never let this happen again to another patient. And if we were overrunning, hopefully we never overrun with you again. But if we were to, now we know that we should come out in between to explain this.
I've heard enough of this.
No,
you know
absolutely.
what? I've wasted time. I've come in today and nothing's going to get done now because we've got, 10 minutes left.
Yep.
I'd rather just leave a complaint and leave. Is that okay? Can I just leave a complaint?
That's absolutely fine. And if you'd like me to walk you through the complaints procedure, I'm happy to do that.
Yeah,
but while you're here today,
I don't want you to walk me through anything. I want to speak to the practice manager and see if there's another dentist that can see me, because you've just not handled me professionally at all.
Absolutely, I understand how you're feeling and I'd like to get that done for you. But whilst you're here today, is there anything else that I can do for you before we escalate things further?
Not even thank you for your time, but I'm going to just take my leave early.
Okay, thank you very much for your time today, Mr. Shiraz. So what can we learn from this video? So what you've seen is how a dentist should manage a situation like this, how they should act and communicate with the patient, and how empathetic they should be. There's also the part of the complaints procedure that when a patient asks to lodge a complaint, they should always be given the steps and the opportunity to complain. As well as this, there was a small portion about confidentiality where the patient was asking about the previous patient's appointment. And the main thing is just making sure that you stay calm and you handle the situation. No matter how angry the patient gets, you're the one looking after them. That's it for the video. Thanks for watching, guys. I'll see you in the next one.